This next lecture is entitled The Medical Director, an Administrative Perspective. I want you to sit back and look at this lecture as an administrative workshop. Despite the fact that most of you say, I don't need to know anything about administration, I'm just going to be a clinician. I'm going to be the medical director clinician of this program. Unfortunately, as medical director or as a physician involved in the management and operations of a wound care and hyperbaric facility, you're going to be asked to wear many hats. Many of those hats are going to be clinical, but some of them are going to be from an administrative nature, as well as other perspectives from the operations of the program. And we're going to walk through just a few of those. So let's give you an overview of what some of those responsibilities might be. You have certainly a responsibility as a clinician to the patient for their safety, well-being, for the decision process. You also have, as we discussed, a responsibility to the program and the operations. And we'll walk through some of those responsibilities as well. But you also have a responsibility to your colleagues and the other providers. Whether they're the technicians, the nurses, or other physicians in the program, you have a responsibility to them. And we're going to talk about some of those responsibilities. We're going to also discuss some of the treatment guidelines and algorithms that may be appropriate and how you put those algorithms together, how you build those algorithms, how you roll those algorithms and utilize those protocols in clinical practice. We're going to talk about looking to CMS and other regulatory agencies for some of the policies and procedures, billing and coding issues that will also have a role in how your program functions. We're going to spend a brief amount of time talking about some training and certification opportunities, things that you might want to consider, both for yourself as well as for the others in the program, your colleagues, nurses, technicians, other staff within the program. And then I'm going to end with some insight on business and marketing. And again, you might say, listen, the hospital or facility hires a business and marketing team, and that may be true. However, you are going to be a part of that team, and you need to have a handle on how you possibly may contribute in a positive fashion to the business and marketing effort.